Next slide, please. So we are finished with enrollment. Like I said, this is the basics. So now we will go to Daniel Idzkowski, and he will talk about the 4 parts of Medicare and give you a basic overview of that. You're up now, Dan, and thank you very much, everyone.
Great. Ginger, before I go, could you just give a couple sentence explanation about the special enrollment period?
Sure. Special enrollment periods are there for people because things happen. For Medicare, you forget to enroll in Part B, or you decide you don't want to have Part B, or you have an employer insurance. So the special enrollment periods are there for people to make these decisions and get their chance to enroll. There are many people out there who decide not to enroll in Medicare Part B when they are first eligible during their initial enrollment period, and then decide later down the road they are going to want to do that. So there is something called the general enrollment period where a person may go and apply for Medicare Part B and then get it at a later date. But you have to remember, as I said, if you enroll later, you may be penalized for not enrolling. And the penalty for enrolling is Part B late, outside of when you're first initially eligible to enroll, is that you will pay a 10% penalty for every 12-month period in which you were not enrolled in Medicare Part B when you were first entitled to be enrolled. So there are places that you can go. You can even call Social Security to find more about the special enrollment periods for initially enrolling in Medicare. We're not talking about any other part of Medicare right now other than initial enrollment. So you can call your ADRC in your county if you're from another county, or through the Department of Aging, or even through the Disability Resource Center here in Milwaukee County if you are under the age of 60, to find out about any special enrollment periods other than the ones that you are eligible for initial enrollment.
Great. Thank you so much, Ginger.
You're welcome.
So with that, I'm just going to provide a very brief overview of the different components of Medicare. I want to start initially by making 4 points to remember. One is that Medicare is healthcare funding mechanism through payroll taxes that you have contributed through FICA. It's principally a funding mechanism for healthcare. 2, Medicare does not cover everything, and it generally does not pay for long-term care, with some exceptions. 3, Medicare coverage is not free. For most folks, it requires ongoing premium, co-insurance, and in some cases, co-pays. So you still have to pay for coverage and for your care, even though you have Medicare coverage. 4, Medicare coverage is generally not automatic. You have a lot of choices. Some parts of Medicare are optional, and there are supplemental coverage options that are available as well. So it can be confusing, but there is a lot of choice built into the Medicare program. And again, I'm going to talk about original Medicare, and then I'm going to talk about Medicare Advantage. So as you can see on this initial screen, there are 4 general parts of Medicare. Those are the different parts of the Medicare law. Part A generally covers hospital insurance benefits. Part B, medical, doctor, and treatment benefits. Part C is the Medicare Advantage plan, which I'm sure you've heard a lot about. And those are private insurance plans that combine the benefits of Part A and Part B into one policy and have a dedicated provider network, like an HMO and a PPO that you'll be enrolled in. And they sometimes can include, many times do include Part D coverage, which is prescription drug coverage. Part D is an optional coverage that you can choose or not choose to enroll in. And Ginger will talk much more about Part B a little later in the presentation. Wisconsin also has a senior care program that provides prescription drug coverage for older adults as well. Original Medicare is the core of the program. It includes Part A and Part B, hospital insurance and medical insurance. Part A, hospital insurance, covers inpatient care in hospitals, a limited amount of skilled nursing facility care, generally given the fact that you have had a qualifying 3-day stay, inpatient stay in the hospital. It covers hospice services at end of life, and it covers home health care. Now, there was a change under COVID. Some flexibilities were built in, and we'll talk about this just a second, but in terms of skilled nursing facility care, if you had been an inpatient admitted to a hospital and you had a 3-night stay essentially in the hospital, you would qualify, if necessary, for skilled nursing care for a certain number of days. And under the new provisions that CMS passed under the COVID-19 crisis, if you cannot if you cannot stay at home, or if you have a COVID-related treatment or illness, you can be admitted to a skilled nursing facility without a 3-day stay in the hospital. So there was some additional flexibility added. Now, as I mentioned,
Dan, would you mind repeating the past couple things you said? I think you cut out just for a little bit there.
Oh, I'm sorry.
That's
sure.
Okay, just like the last 30 seconds.
Yep, so just to quickly recap, the Medicare Part A hospital insurance provisions do provide for a limited amount of skilled nursing care. So this would be care in a nursing home or another type of rehabilitation facility. In the changes that were made under COVID-19 previously, you have to have a 3-day stay in the hospital as an inpatient, not admitted for observation, not there just as an outpatient, but a 3-day inpatient admitted stay in order to get coverage for any skilled nursing care that you'd receive after that hospital stay. Under COVID-19, if you have a COVID-19 related illness, or if you cannot access hospital care and you cannot stay at home, again, due to a COVID-related condition, you can be admitted to a skilled nursing facility without meeting the 3-day hospital stay requirement. So as I mentioned, Medicare coverage is not free in general, and Pamela will talk about some other programs that can help people with economic requirements under Medicare. But in general, what do you pay for if you, what is covered by Medicare for inpatient hospital stays? So for each stay, they're divided into 60-day benefit periods, more or less. And for each benefit period in 2020, there is a deductible that you have to meet before you get Medicare coverage. And in 2020, that deductible is $1,408 for days 1 to 60. For days 61 to 90, your responsibility is $352 per day out of pocket costs. And then for days 91 to 150, $704 per day. And we would just note that under Medicare, you have those 90 days automatically, and then you have 60 lifetime reserve days that you can use throughout your life to add on to that length of stay. After 150 days in the hospital, you would be responsible for all costs of care. Similarly, for skilled nursing care, which would occur typically after a 3-day hospital stay, for each benefit period, for the first 20 days of skilled nursing care, Medicare would fully cover that. Under the 21 to 100 days, you would be responsible for $176 per day. And for all days after 100 days in a skilled nursing facility, you would be responsible for all costs of care. And again, to reiterate, Medicare does not cover long-term care. So a long-term stay in a nursing home that goes beyond rehabilitative care is not covered under Medicare. There are other programs available generally through Medicaid that would cover long-term care, but that is a different benefit that you can find more about also by calling the Aging and Disability Resource Center in your county. Medicare Part B. Services covered under Medicare Part D include services from doctors and other healthcare providers, outpatient care, home health care, durable medical equipment like wheelchairs, walkers, hospital beds, and other equipment, and many preventative services like screenings, shots, or vaccines, and yearly wellness visits. This includes outpatient laboratory, medical and surgical supplies, and the changes under COVID-19 for coverage are that coronavirus testing should be provided free of charge under Medicare, and telehealth visits are covered and should be provided free of charge as well. So you should not be getting a separate bill for a telehealth visit charge if you're enrolled in Medicare Part B. Again, there is a premium with Medicare Part B. With Medicare Part A, for the vast majority of folks, there is no premium. It's premium free. For Medicare Part B, however, there is a premium, and for 2020, that premium is $144.60. Generally, that premium will be deducted from your Social Security retirement benefit automatically. Those with yearly income over $85,000 if they're single, or $170,000 as a couple, will pay higher Part B premiums on sort of a upward sliding scale. So in original Medicare, that's Part A and Part B, there's also a yearly deductible of $198 in 2020, and then 20% coinsurance for most services. So this is under Part B. So let's say you had a $1,000 bill for a treatment that you underwent that was covered by Medicare Part B. that was on an outpatient basis. Medicare would pay 80%